I was quite tired, and I travel considerably, and at that time I would go through an airport and I'd have to stop and rest, and so I realized that I needed to check in with a doctor and see what was going on.
So Mr. Richardson has cardiomyopathy, ischemic cardiomyopathy from coronary artery disease, multiple blockages that really weakened his heart over time, and that's how I found him many, many years ago, about 15 years ago.
Pretty common that you neglect yourself. You think nothing's ever going to be wrong, but I found out I had high blood pressure and I was border diabetic, and did a CAT scan, and during that time they found out that I had an irregular heartbeat. So at that time I was told I needed to go to the emergency room, and next thing I knew, I was having a quadruple bypass.
We were able to intervene on his cardiovascular disease, coronaries, fix those, but what happened was the heart was so weak, so he ended up needing a device, which is different than a pacemaker. It's the shock box. A defibrillator is put in under the skin, and again, like the pacemaker, the wires will go to the heart, but then this box is able to protect the patient, shock them, if the heart stops, or if the heart goes into ventricular fibrillation or ventricular tachycardia.
Well, I'm able to carry on my daily work duties, and I can travel, and I'm not so sure if I hadn't had this great care that I would have been able to do that at my age. I'm going on 71 and still working every day, so I give Dr. Varughese lots of credit that she's helped me sustain a good life.
He's been able to function normally, and it has actually improved the function of his heart. He can walk around, he's not short of breath, he can take care of his thousands of employees and customers, and what a blessing that's been for him.